The Omaha Police Department responds to thousands of mental health calls every year, and sometimes they can turn aggressive. Good evening, I'm Jennifer Griswold. Reporter Kent Lutzen has more on how the department is working to de-escalate these situations.
We all know someone struggling with mental health, and the Omaha Police Department is no stranger to this growing crisis either. And recent protesters have been calling for more resources to be funneled into mental health, something the Omaha Police Department says they're already working on.
I think the message is fairly clear that we do, as a society, need to address the mental health elements in our community.
Sergeant Jason Heft and the department's mental health coordinator, Lindsay Kroll, are working on a program that provides intervention for residents that are dealing with a mental health crisis. They are doing this with licensed therapists, or what the department calls co-responders.
The big goal of the program, and really the whole behavioral health and wellness unit within OPD, is to divert folks who have mental health struggles from jail, incarceration, involuntary hospitalization when that's not necessary, and get people really connected to get their needs met.
Something new to this program is officers wear their soft uniforms and respond in unmarked cars. Kroll says this removes some of the criminal elements and mental health stigmas when responding to these calls. Heft adds that the department responds to roughly 15,000 to 20,000 mental health calls a year, so co-responders are needed to help de-escalate some of these situations.
Our future goal, of course, is that we will have the co-responders as well as those paired officers that have that special mental health training, that they will be able to respond directly to those calls.
The co-responders are looked at as a gap where other providers maybe can't respond. Kroll says OPD's co-responders help connect those in need with resources to prevent future mental health crisis calls to 911.
When officers respond with co-responders, they get to see how therapists function, how therapists ask questions, and how people respond to that. So there's a lot of informal training that happens just by being a part of that intervention and that call.
In Omaha, Kent Lutzen, 3 News Now.
In the future, Kroll and Heft hope to have co-responders in all of Omaha's 5 precincts, all of them driving with officers for their entire shift. The program currently only has 2 co-responders. They're looking to recruit more.